period for asymptomatic COVID-19 cases. The country implemented the measures in a bid to blunt mass Omicron-induced disruption as infections hit new highs in multiple U.S. states and Europe, bringing global air travel to a near standstill. To talk more on this, I'm joined by the Daily Maverick's associate editor, Brooks Spector. Brooks, thank you so much for your time and thank you for joining us.
Good evening. Good to be with you.
I think this past weekend really saw the U.S. hard hit by the Omicron surge in COVID-19 infections. We saw thousands of flights being cancelled. And of course, this also saw a lot of criticism being directed towards the Biden administration. Just talk to us about how U.S. President Joe Biden's government has handled this particular surge in COVID-19 cases when compared to his counterparts in Europe, and even how we've handled it here in South Africa.
Well, I think we should roll that film back maybe a month or two ago. American officials were cautiously optimistic. They were noting that there were over 60% of the population had at that time been fully vaccinated, which was a pretty good number. Not as good as some countries, but certainly much better than much of the world. And at the same time, they were beginning to move in the direction of figuring out how they were going to deliver home testing kits to everybody, basically. The government was on the way to pledging 1 billion test kits, which is obviously more than the total population, but it doesn't guarantee that everybody is going to be able to be tested every day, which is something of the issue. But the Omicron variation, and we should remember that viruses do one thing really, really well, which is they mutate. The Omicron variation took America to a considerable degree by surprise. And the first reaction was to limit entry into the U.S. from a wide swathe of countries, many of which were in southern Africa, and at the same time beginning to realize that the COVID pandemic effects economically, socially, politically were nowhere near over, and that all of the shutdowns and the gradual returning to something approaching the beginnings of normality, all of that was going to be set back. Looking at today's newspaper, the headlines from the Washington Post, for example, what they're talking about now are, among other things, the fact that hospitals are now having to brace for the surge in people who will be coming to them because of Omicron infections. Now, we should remember that most of the people ending up in the hospitals now are people who were not vaccinated. And that gets you to the political dimensions of the problem. Vaccination and mask wearing and social distancing have, in a way in the United States, which is not quite unique, but is close, has become a very politicized issue. Many Republican politicians in the United States have stoked the fire that these kinds of measures, from vaccinations to social distancing and anything in between, these are the harbingers of government control over your daily life in all ways and means. Now, obviously, that's not true, but it was sufficient to tap into a deep vein of suspicion about the government, and that tied in turn to the argument that continues to be made that somehow, in some way, Joe Biden was an illegitimately elected president. Now, this is all Republican dogma, and there's very little evidence in any of this. But nevertheless, a lot of people began to embrace this with a degree of vigor that has made the problem such that most of the people now showing up in hospitals are people who aren't vaccinated.
You've raised quite a number of important points, salient points, in fact, that I want us to circle back to in a moment. But you're right in saying that the unpredictability of the virus is something that world leaders the world over have had to contend with. Joe Biden's administration made the unpopular decision of imposing travel bans on southern African countries once South African scientists actually, released information about the detected Omicron variant. That unpopular decision could not have boded well for President Biden.
Sorry, I'm losing your audio.
All right, I'm not sure which part you caught, but I do want to talk about the travel ban imposed by Joe Biden's administration on southern African countries. I mentioned that the unpredictability of the virus is something that his administration and many other governments around the world have had to contend with. However, the decision was an unpopular one. It was severely criticized, largely because of this issue around whether or not it was based on any scientific justification. Talk to us about that and the effects that decision has had on his office.
Well, I mean, part of the problem is that right at the outset, when South African scientists and researchers were the first to identify the Omicron variant, it was a little bit too quickly picked up by some news media and called the South African variant, which of course, we now know doesn't really have much water to it. But for the first few days, certainly, that was the predominant narrative in much of the news coverage. The immunologist, Tony Fauci, when he went on television to explain the limitations on travel, initially said this was done in an abundance of caution. And he was pretty clear about not saying it was because Southern Africa was the home base for the virus or anything of the kind. But we should also remember that this was not done just by the U.S. There were a number of other nations which imposed similar or more stringent bans. And I would encourage you, for example, to try to figure out how to get in and out of China this week as a regular commercial traveler from pretty much anywhere in Africa. There are lots of countries with variations of this. The problem is there is no current internationally accepted appropriate standard for what constitutes walling off country A from countries B through Z. And so that you get every variant pretty much that you can imagine. The end result of this is a certain degree of cynicism, more here than there was in the United States, because quite frankly, the ban on travel from Southern Africa didn't affect Americans all that much. The annoyance and the white heat about it was more from this continent than it was from the United States toward this continent. But nevertheless, the signals are that they're rolling this back, I guess in part because the virus pretty much in its current new mutation as Omicron has pretty much gone everywhere. And even if you are in China, in the city of Xi'an, I suspect that by now they're probably finding cases of it, even though that city, which is several millions of people, is under the most severe kind of lockdown that you can imagine. One person per family every couple of days is now allowed out to do necessary shopping, and that's it. So if we look at the world texture of this, there are all kinds of different versions of it. It's complicated further in the United States because the national government really doesn't have the legal authority easily to impose national standards that are applied in all cases in all states. Mm-hmm. Many state governments are choosing to find very different approaches to it. Whether they're good or bad is a whole different question, but the federal government really has not been able to impose mandates in most areas that require things, except in, say, the military, where the government is in charge of the military, and so they can mandate everyone should have the vaccines and or wear masks. They can recommend, as they have just done today, that if you are asymptomatic, that is, if you don't show any symptoms, And if you are adequately protected, your quarantine period should now be 5 days. To me, that seems a little bit over hasty, because if yesterday it was 10 days, 2 weeks, and now it's 5 days, this is going to leave many people in the country not only confused,
Sure.
but even more suspicious about the government than they were before.
Sure. Before we wrap up the conversation, Brooks, I want to go back to an earlier point that you raised about the narrative being propagated by Republicans when it comes to the Biden administration, and that has to do with the COVID-19 regulations and measures being implemented, vaccine mandates, for instance, for federal workers, federal employees. Talk to us about the effects of those kinds of decisions being made by the Biden administration. I mean, our own government has put together a task team to look into vaccine mandates. And of course, you know, whichever side it falls, you know, the issue is a complicated one. And should a vaccine mandatory policy be implemented, it is likely to have some dissension. And I wonder about what's happening in the U.S. with regards to that, and how the Biden administration is handling some of the pushback that it's been receiving on issues around mandatory vaccines, and how it's contending with this narrative being propagated by the Republicans.
Well, I mean, a couple of points here. You're quite right that the federal government has imposed mandates on the people it has direct hires over, as well as immediate contractors, and of course the military as well. They have the authority to do that, and they have said effectively that if you don't follow these rules, we can take measures to terminate your employment or involvement in the forces. But because individual states have considerable authority over public health measures in each and every state, Republican administrators and governors of many states have tangled this question together with the more general opposition to the Biden administration on a whole range of other topics, making it something of a patchwork quilt in which state regulations apply in what way, and in another state they apply in another way. Now, this looked at holistically, this clearly is not the right way to do this, but the government, at least at this point, absent new laws or regulations that can be upheld in the courts, is really not in the position of enforcing the kind of national mandate or national lockdown or curfew that you can do in a country like South Africa, where the national government has ultimate authority over any action that might take place. So the government in the U.S. is much of it is trying to convince and cajole people into doing things, right, to announce that these are preferred, these are recommended, and even the question of vaccine, what do we call them? Vaccine certificates, vaccine passports for boarding an airplane. Even that is a contentious issue which has yet to be implemented. It's not an entirely pretty picture. And the saving part of it is, of course, that the national rates of vaccination are relatively high. The vaccines are available. The question is getting the people who refuse to be vaccinated to get them to the station where they can get them, because unfortunately, as I said earlier, the statistics are indicating that the vast proportion of people who are ending up in hospitals now as patients are people who refuse to be vaccinated. Yeah. If you've been vaccinated and you have to go to the hospital, the symptoms are usually much milder. The biggest question now, in some people's minds at least, is the wear and tear and the burnout among health professionals in hospitals that are seeing what is potentially the current new surge of patients.
Brooks, unfortunately, we are going to have to wrap up this conversation, but I do want to give you an opportunity. Obviously, as a country, we are mourning the loss of the late Archbishop Emeritus Desmond Tutu. I know that you have your own sort of thoughts and reflections on the man that was, and I suppose just share that with us this evening.
Yeah, thank you very much. Let me start by saying he was my wife's parish priest here many years ago in Johannesburg, and so uh, the family has a sense of connection to him and to his memory. And I can recall seeing him in various circumstances and in various places where his what shall we say, his abundance of spirit was clear to people. And when I was living here in the 1980s, it was clear that he was a unique moral force that was not able to be stilled, even if the national broadcaster wouldn't broadcast his image or his speeches or his words. Somehow people heard him. Um, I remember also that when he was heading the Truth and Reconciliation Commission, it was an extraordinary thing to watch someone like him so personally engaged in the requirements of that task. The idea that people should recant, the idea that people should admit their complicity or their behavior, and to be personally sad and brought to tears when such a thing would not happen. The world needs more people like this. They need people like the late Archbishop. They need people like the Dalai Lama. And I think when former President Obama sent his message of condolence, I think he was speaking for the vast majority of Americans about the man's assured place in history.
Thank you very much. That's the Daily Maverick's associate editor, Brooks Spector, joining us there to discuss just how the U.S. has handled the COVID-19 surge in the Omicron variant, and also just looking at some of the decisions that the Biden administration has made in response to that surge, and certainly other very all-important discussions around the pandemic, including that vaccination mandatory policy being instituted